I'm Vanessa Hansen with Cayman Life TV. We're at the 11th annual Cayman Heart Fund International Symposium, bringing together cardiac specialists from around the world here to talk to our medical specialists and share some of the new information and best practices that are coming about. I'm joined now by Dr. Ian Del Conde. He is with the Miami Cardiac and Vascular Institute. That's part of the Baptist Health South Florida group. Thanks so much for being here.
Thank you very much for the invite.
Now, your topic is on PFOs that you're going to be talking to the specialists about. Can you explain what that is?
Absolutely. So PFO stands for patent foramen ovale, which in normal language means that there is a small hole in the heart that communicates the right side of the heart and the left side of the heart. So let me just spend a few seconds describing what this is. So we have a right side of the heart that receives blood from the venous system, and then normally that right side of the heart pumps blood to the lungs. Blood gets oxygen in the lungs, returns to the left side of the heart, and from the left side of the heart it gets pumped to the rest of the body, from the brain down to the kidneys, the legs, etc., and then it returns to the heart. Now, when we are in utero, in other words, where we're still in our mother's womb, things work differently because babies, obviously, when they're in the womb, they don't have lungs to breathe oxygen, so they get their oxygenated blood from the placenta. Okay. So now you have the placenta carrying oxygenated blood to the baby, to the right side of the heart, but then that oxygenated blood in the right side of the heart has to cross to the left side of the heart so it can then be pumped to the rest of the body. So when we are babies in our mother's womb, there's a little hole called a PFO, and that blood shunts to the left side of the heart, and then that's how our body gets oxygen. So a PFO is normal in, when babies are born. But this hole should start closing as soon as the baby takes his or her first breath, immediately after birth.
Okay.
And what we've seen is that 1 out of every 4 babies will not have closure of that hole. Mm-hmm. And this is what becomes a PFO, a patent foramen ovale, which basically means that the hole has not closed. For the most part, this will not be an issue in somebody's life. Mm-hmm. As you can imagine, 1 out of every 4 people still have some degree of opening in that hole. So most people will live life completely unimpeded, uneventfully, despite this. So this is not a condition, this is not a disease. However, we do start paying attention to PFOs when we see patients, typically youngish people, less than 60 years of age or so, who for unexplained reasons have a stroke. Okay. So when we see a youngish person with a stroke out of the blue, then we start thinking about PFOs, because a PFO could theoretically allow a small blood clot that forms in a small vein that would normally not be an issue. It allows that small blood clot to go through that little hole into the left side of the heart, gain access to the arterial circulation, and then go to the brain, and that could be a big problem. So there has been a huge debate over the past 20 years or so whether PFOs are relevant. If we see someone with a stroke and a PFO, which are very common, as you can imagine, should we close the PFO? And for the past 20 years, this was a huge debate between neurologists and cardiologists, but things have really become a lot clearer since last September 2017, when 3 large trials comparing closure of the PFO versus no closure showed that closing a PFO can actually decrease the risk of a stroke in people who've already had a stroke and have a PFO.
Okay. So when the baby's born, would a pediatrician say, oh, we've just noticed that the heart didn't close, the hole didn't close all the way, or would it be caught later?
So it would normally not even be looked for, because we know to begin with that 25% of the population is going to have this, and it's not going to be an issue. So we're not going to go looking for a PFO, because the vast majority of people will go about life, even with a PFO, and this will not be a problem. Okay. So things change when somebody, unfortunately, has an event such as a stroke. Okay. That's when we look for it.
And so that's when you look for it. And now the latest information is that closing
closing the PFO in carefully selected patients is a good idea. And the way that these PFOs are closed nowadays, fortunately, doesn't require a big open cardiac surgery. It's done through a minimally invasive procedure through the groin. It takes about 30, 45 minutes, and the results are truly excellent.
Wow. Okay. So yeah, when you talk about a young person having a stroke, I would find that myself alarming. You know, why would you? So that's something that the specialist should start looking at.
Correct.
And then they can do something about it to prevent.
Correct,
future.
because when you just look at all types of strokes out there, about a third of them, a third of all the strokes that we see, we will not be able initially to explain why exactly that person had a stroke. And now that we've had this information about PFOs, I think that it's a big clue that if you have someone with a stroke, you can't really explain it, then you should really start looking for a PFO. And if you find it, you might very well consider closing it.
Okay. Dr. Del Conde, thank you so much for joining us.
It's my pleasure.
Really
Thank you.
interesting information, and it's good that you're able to share that with our specialists here as well.
Thank you so much.
All right, I'm Vanessa Hansen with Cayman Life TV. We're at the 11th Annual Cayman Heart Fund International Symposium.